Welcome everyone, and thanks for watching today. My name is Rich Nolte, practicing at Pine Ridge Dental in Lincoln, Nebraska. We realize that each of you may be watching for a different reason. You may have been told that you have sleep apnea and want to know more about alternatives to your CPAP. You may have a child with ADHD or who struggles with bedwetting. You may be here because your spouse snores so badly that you sleep in different rooms. By the end of the presentations, our goal for you is to understand that all these things that seem very different may have a common root cause. As we go through this presentation, we start with a focus on children. If you're here as an adult with sleep apnea, at first it may seem odd that we're talking about children, but what we've learned is that adults with sleep apnea very often had signs and symptoms as children. There's a good chance we may describe things that you struggled with as a child too. So let's get started. There's a silent crisis in America. Many of the conditions listed on the left side of the screen present in children. Conditions like ADD, ADHD, bedwetting, mouth breathing, chronic allergies, crowded, crooked teeth, dark circles under the eyes, and swollen tonsils or adenoids, to name just a few. Many of the conditions listed on the right side of the screen also present in adults. Conditions including depression, anxiety, fibromyalgia, obesity, bruxism, Alzheimer's, diabetes, cancer, and premature death. And research has shown that 9 out of 10 in America suffer from one or more of these conditions. Now, as we go forward in the presentation, we'll be focusing a lot on children, and the reason for this is that if this epidemic is not corrected in childhood, it can continue into adult life. We're going to show you a few images of some children. We'd like for you to consider if they look healthy to you. In the past, we might have thought they looked healthy too, but knowing what we know now, we'll show you some of the things that stand out. This is Michael on the left. You'll notice that Michael has a retrognathic or retruded chin, which gives him the appearance of being overweight. This little gal in the middle has visible dark circles under her eyes, dry, chapped lips, a dimpled chin, and lack of symmetry in her face. Then the third child also has a double dimpled chin, dry lips, and dark circles under his eyes. Let's take a look at a few more. The first girl has dark circles under her eyes, a narrow, small chin, dry lips. She looks tired, but you'll also notice that she has her head slightly tilted. And we know that's because that's her body's natural response to opening her airway. Second girl, she has dark circles under her eyes, can't close her mouth, over her teeth, very tiny chin, lack of symmetry. And the third, dark circles, red blotchy skin, lack of symmetry, red chapped lips. And all of these kiddos generally look pretty tired. But this is what a lot of our children look like these days. In fact, this has almost become what normal looks like. But why are we seeing so many children who look like this? So just like leaves on a tree are visibly seen, the symptoms we just identified in the photos of those kids are visible symptoms we can see in our patients. ADHD, ADD, bedwetting, sleep issues, crowded, crooked teeth, mouth breathing, chronic allergies, snoring, difficulty in school. And what we know is that there's an underlying cause, and that underlying cause is a compromised airway. And there's a possible root cause. Things like a soft food diet, a weak tongue, processed foods, weak facial muscles, low tongue posture, and a tongue thrust limited to no breastfeeding. Where does this come from? Why are we seeing so many children who have really crowded and crooked teeth? Why do 80% of our children typically need orthodontics today? When this is really what we should be seeing. Notice the beautiful U-shaped dental arch with adequate spacing in between the teeth. We know that for this child, when the baby teeth fall out and the permanents start coming in, there will be room for their permanent teeth. But we're calling this an endangered species because we're really not seeing this much at all anymore. Why is that? Is that because our children have really big teeth? Or is there something else going on? Most of the growth and development that humans experience takes place in the lower third of the skull. In the upper jaw, the maxilla, in the lower jaw, the mandible. Normal craniofacial growth is wider, forward, and downward. So why are so many children suffering from abnormal growth and development? To get answers to this question, we're going to look back at some anthropology. This is Dr. Robert Corricini. Dr. Corricini has done a lot of research on the development of the human skull. Today, we're going to look at his fossil studies and his population. When Dr. Corricini looked at human skulls from 400 years ago, he found that those skulls had bigger upper and lower jaws and that there was room for 32 teeth in those jaws. There was very little incidence of crowded or crooked teeth, and obviously there were no orthodontists around to make that happen. In present time, very few people have all 32, including their wisdom teeth, and we don't even have room for the other 28 teeth, often without them being crowded and crooked, often leading to even more extractions. Taking his research a bit further, Dr. Corricini also studied isolated rural populations, groups of people who were not exposed to things like processed foods and formula. What he found was that these populations breastfed their children for many years, 2 to 3 years, and that they ate a diet that was comprised of hard, tough foods, dried meat, and hard root vegetables. In these populations, they had very little incidence of crowding or crooked teeth, and they had perfectly formed upper and lower jaws. So here are his conclusions. Chewing tough foods promotes proper bone growth. When processed foods became prevalent in modern times, crooked teeth also became much more prevalent. Soft diets increase underdevelopment of both jaws, and they increase the prevalence of crooked teeth. Dr. Corricini also wanted to see if that still exists today, and continued to observe these isolated rural populations as Western culture was introduced, and here's what he observed. In the first generation after processed foods and soft food diets were introduced, 50% of the population began to experience an increase in malocclusion, or crowded, crooked teeth. After the second generation, this increased to 70%, and after the third generation, this jumped to 85%. Fun fact, it takes 27,000 years for a genetic mutation to express itself in 51% of the human population. So how did this happen in just one generation? What that tells us is that malocclusion is not inherited, it is acquired. I'm sure the majority of us think that, well, my parents needed braces, so I'll need them too. But what this really tells us is that crowded, crooked teeth is not caused by genetics, it's caused by something else. It's caused by cultural changes. So what do we mean by Western culture? Well, we no longer breastfeed our babies for 2 to 3 years. Instead, we nurse our babies for 6 weeks or 6 months if we're lucky. As busy moms at work, we don't have the luxury of breastfeeding that long because we have to go back to work. And when we do, we transition them to bottles and soft foods. But what we know is that when babies breastfeed, they work really hard to express the milk, and they have to use their facial muscles to do so. Their tongue is also in the proper position upward and forward in the palate. But when they're bottle feeding, the tongue position is down and they don't have to work very hard to extract the milk. So they're not using their facial muscles like they would if they were breastfeeding. In fact, the milk somewhat flows out of the bottle without the babies needing to do much work at all. And then after they're done bottle feeding, what do we give them? Soft foods. Soft foods like this: Gerber baby food, melt in your mouth finger foods, yogurt, and applesauce pouches. Most of us have had every one of these or similar products in our home, but why do we give this to our babies? Well, because of convenience for sure, but also because why? We're afraid they're going to choke, right? But what we really should be giving our kiddos are things like this: hard root vegetables, meats, foods that help our babies grow and develop in the lower 2/3 of their face. So here's what we do know. Most malocclusion is acquired, not inherited. Malocclusion is unique to Western culture, and the presence of malocclusion is a key indicator of an underdeveloped airway. We're going to transition here and talk a bit about the importance of tongue function and posture. In doing so, let's look at some research that was done by Dr. James Sim Wallace. What we have observed is that an early soft diet prevents the development of muscle fibers of the tongue, resulting in a weaker tongue which cannot drive the primary dentition or teeth out into a spaced relationship with fully developed arches, which will lead to more crowding of the permanent teeth. This is one of our favorite slides because it demonstrates how the tongue should work. Just like scaffolding to a house, your tongue is the scaffolding to your teeth and acts like a natural retainer. So what happens if the scaffolding in a house crumbles? Well, the bricks will move, they will shift. So it's the same for the tongue. If the tongue is not working properly, and you can't get to the roof of your mouth, what happens? The teeth will move and shift. So your tongue is really important, and that's almost like having an orthodontist in your mouth. The tongue helps retain the teeth in the proper position. When your tongue is not strong and fully functioning, you'll end up with a V-shaped Gothic arch and crowded, crooked teeth. When your tongue is strong and functions correctly, you'll have a beautiful U-shaped arch that has room for all of your teeth without being crowded and crooked. So this is a great image of the maxilla because most of us don't realize that the upper jaw does more than just house the upper teeth. It also makes up the sinus cavity and the lower orbits of the eyes. Dr. Nolte states that dental arch expansion, widening, improves sleep disordered breathing in patients with upper and lower jaw constriction, and that can be a valid treatment for sleep disordered breathing. This demonstrates what our upper jaws look like today compared to what they looked like in earlier times. Notice the modern day scan and that high palate, narrow dental arch, but look at the prehistoric scan and that beautiful U-shaped arch. We know that the tongue is able to get up and forward in the palate and is working properly in this prehistoric picture. This image shows us that the upper and lower jaws are a major part of our airway development. You can see that if the upper jaw is not fully developed, it will affect the nasal airway. In addition, an underdeveloped upper jaw keeps the lower jaw from fully developing because the upper teeth trap the lower teeth, and the jaw can't expand forward to the correct position. When the lower jaw does not fully develop, it impacts the lower airway. What does your airway look like? What does your child's airway look like? Which airway would you rather have, a narrow straw or a wide garden hose? Here are some images of airways. The yellow and red areas indicate where they're constricted. In a severely constricted lower airway, a typical mouth breather, a child with Asperger's syndrome, and an adult with sleep apnea. So we're going to have you watch a short video, and this video really ties together what we just learned.
Just a few hundred years ago, the human face was different. It was forward grown. Her wide profile and large dental arches ensured straight teeth and room for her tongue. Most importantly, she had plenty of space behind her upper jaw so she could breathe through her nose with ease. The modern face has changed. From childhood, her dental arches are less developed, crowding her teeth and giving her less space for her tongue, which impacts her airway. Many believe this stems from a number of causes, such as allergies that affect breathing. Another is the poor nutrition and softness of modern diets, causing toddlers to have underdeveloped chewing muscles and smaller dental arches. Because her upper jaw is too far back, she will struggle to breathe normally through her nose. To get more oxygen, she will compensate by opening her mouth to breathe, bringing her lower jaw down and back, creating a downswing of the face. This is how her undergrown upper jaw creates the appearance of buck teeth. She's actually compensating in order to breathe. If not corrected, the problem carries into adulthood. Extractions were documented in the 1600s as a way to treat crowding. Although they are a quick fix, they don't treat the problem of underdeveloped arches and have been implicated in harming the facial profile, making them the subject of much debate even today. Adulthood. In order to breathe, she will slouch her head forward to prop open her airway, creating a lifetime of neck and back pain. This is the infamous forward head posture. Having a healthy airway is crucial to the survival of life, and especially so during sleep. When muscles around the throat relax during sleep, a healthy airway stays open because the tongue is sitting forward and has enough space to be suctioned up against the fully grown palate. With underdeveloped jaws and dental arches, the palate is too small for the fully grown tongue, which is sitting back to begin with. When she sleeps, her tongue does not suction, rather it falls back and cuts off her airway. This is obstructive sleep apnea. Like crooked teeth, it's a modern condition, however, it can reduce life expectancy. Not surprisingly, obstructive sleep apnea is marked by the same traits that describe the headgear effect. Both jaws are grown down and back, creating a clockwise rotation in the lower third of the face. The myth of the overgrown upper jaw that needs to be held back has long since been replaced with science. Science has shown that young children can be buck-toothed naturally, and that the lower jaw catches up over time with a fully developed upper jaw. Essential to this is nutrition, the use of chewing muscles early on in life, and good breathing habits. This means breathing through the nose with the mouth closed and the tongue resting up against the palate. Also, the practice of maxillary expansion has been shown for over a century to correct crooked teeth and improve nasal breathing space. And since 1918, orofacial exercises have been shown to correct mouth breathing habits. Children.
This is baby Eli. We didn't make this video, it was actually recorded by his mother, who's a nurse. But we want to show you this today because it's a great demonstration of what a child looks like when they're struggling to breathe while sleeping.
Now he's holding it.
Notice that baby Eli is sitting up, and imagine how much worse this could be if he was laying flat on his back.
He's trying to take in air.
I want you to pay attention to what his mother does in the video and the changes in
goes.
baby Eli as a result.
Okay, now watch. He's holding it. He's holding it. He's holding it. He's holding it. There he goes. He's still holding his breath, and now he's going to gulp again. And there he goes. That was it again. He's holding it. He's holding it. He's holding it. And again. He's holding. He's holding. He's trying. There he goes. So this has been 3 minutes and 15 seconds, and you can see how many episodes he's had of not getting calm breaths in. Now, watch what happens when I take his jaw and I just bring it forward. If I can. Let's see if I can. And I open his airway. Now, watch what happens when I take his jaw. Just bring his airway forward. Listen to the quiet breathing. There we go. Now he's breathing through his nose. And I brought his airway. I'm opening his airway. Just pulling his jaw forward ever so slightly. And now he's breathing through his nose quietly. His mouth is a little bit open, but he's breathing through his nose. Just by hear how quietly he's breathing, you don't hear him anymore. And all I did is gently bring his jaw forward. Just by hear how quietly he's breathing, you don't hear him anymore. And all I did is gently bring his jaw forward.
So this is a great image of what's going on with baby Eli. And as you can see, the development of the upper and lower jaws has a huge impact on how we breathe. You probably noticed in the video that when his mother pulled his lower jaw forward, he relaxed. His complexion changed, his skin went from bright red to flesh toned, and he was breathing through his nose. So we're going to talk a little bit about the importance and benefits of nasal breathing versus mouth breathing. When you breathe through your nose, the air is warmed, it's filtered, and it's humidified. When you breathe through your mouth, this doesn't happen. The air is unfiltered, it's dry and hitting the back of your throat, causing swollen and inflamed tonsils and adenoids, which further impact your ability to breathe. In addition, nitric oxide is produced in your sinuses. Nitric oxide is a vasodilator and helps our bodies absorb oxygen. When you breathe through your mouth, the oxygen is not mixed with nitric oxide, so your body can't absorb the oxygen as efficiently. So, nasal breathing is very important for our bodies and our overall health. In talking about the importance of nasal breathing versus mouth breathing, I want to look at some research that was done by Dr. Harvold. Dr. Harvold did airway studies on young adolescent monkeys to demonstrate the impact mouth breathing versus nasal breathing has. And essentially what he did was he took monkeys that were once nasal breathers and he blocked their noses with cotton rolls to make them mouth breathers. What he found was that nasal obstruction leads to mouth breathing and low tongue posture, which then leads to malocclusion. The pictures on the left are pictures of the monkeys before their noses were blocked. The pictures on the right are after the monkeys were forced to become mouth breathers. Look at the differences in how the monkeys look in just a short time. You can see the first after picture, the long, narrow face. We call that the melting face syndrome, and the tongue is definitely not in the roof of the mouth. But look at the after picture here. The tongue is protruding out of the mouth, and you can see some changes in the teeth alignment on the far right. Here's what we know. When you have a compromised nasal airway and you breathe through your mouth, it leads to low tongue posture. Mouth breathing also causes the tonsils and adenoids to swell, which further impacts our ability to breathe. So similar to Dr. Harville's research, Dr. Linder Aronson did studies on children, but he looked at children who were mouth breathers versus children who were nasal breathers, and he found that nasal obstruction leads to mouth breathing, which leads to low tongue posture, and as we learned, high rates of malocclusion. So as you can tell, it's really important that we get people, kids and adults, breathing through their noses. So we mentioned in the beginning that ADD is a condition we're seeing in kids, and you may be wondering how all of this is connected. Well, when you have a child who's mouth breathing and has a small airway, it impacts how the child is able to sleep, and they may experience restless sleep. When a child doesn't get a good night's sleep, it impacts their quality of life. So we're going to have you watch another video, and Dr. Ben Moralia is going to talk more about this.
Now take a child, alter their quality of breathing and sleeping. And the real big issue now is how will they be during the day? So now you take a child who's 5, 6, 7, 8, it doesn't matter. Their issue has begun years ago. So it's not like you had 1 or 2 bad nights of sleep. You've had a poor quality of sleeping and breathing for years. And the parents have been struggling with so many different issues, and not the least of which is the ADD, ADHD discussion. Because the child who doesn't get a proper night's sleep with a good quality of breathing throughout the entire night is going to wake up and be unrested. And when you get a child who's had a poor quality night's sleep, poor breathing all night long, and you make that happen for years, you know what you've got? A 6, 7, or 8-year-old that's going to go to school and have trouble learning, have trouble sitting still, have trouble behaving, have trouble cooperating, basically have trouble fitting in to what is supposed to be a quiet and peaceful and learning environment. And it's not long after that where the phone call comes to the parent. And when the phone call comes to the parent from the school, what happens is, we have little Jimmy here and he's a little bit disruptive and we really want you to have him evaluated for ADD and ADHD. They're going to be diagnosed with ADD and ADHD. And our solutions are pharmaceutical. If we are given a pharmaceutical, it's usually in the form of some sort of a stimulant. And what that does to the child is it kind of pushes them over the edge and it brings them back to calm. So you basically take an excited or hyperactive child, you stimulate them more, and you bring them back to a so-called calm. But it doesn't make a better learning child. You're not going to have a child who's able to learn as well. So now you might have the child sitting still in class because they might be a little more numb or relaxed or calm, but it doesn't necessarily make them a better learner. If we have the so-called ADD, ADHD diagnosis, we're talking about hyperactivity. We're talking about all of the things about behavior and development that land in this category. And the interesting thing about research is, and there is current, ongoing, and past research that shows, children who are sleep deprived produce the same exact symptoms as kids who are diagnosed with ADD and ADHD. In fact, there's a nice study that showed children who were diagnosed with ADD and ADHD were mixed with children who were sleep deprived. And in that group of kids, when they tried to analyze them and look at their symptoms and diagnose them, they couldn't tell them apart. And if you have a group of kids and you can't tell apart who's an ADD child and who's a sleep-deprived child, it's no surprise that maybe the ADD and ADHD has a cause. And maybe that cause has to do with the quality of the breathing and the sleeping overnight. And there's a lot of research out there. And one of the pioneers here is Dr. Stephen Sheldon out of Lurie Children's Hospital in Chicago. And he does a wonderful job of researching, and over the decades, he's come to a conclusion, and I've seen him speak, and it's not soon after he jumps on stage and he makes a statement that ADHD and ADD do not exist. They are an outcome of a sleep disorder breathing. They're an outcome of a poor quality of sleep. It's all about the quality of sleep. Another researcher who's produced beautiful research on the same topic is Dr. Karen Bonnick out of Einstein at Yeshiva University. Dr. Karen Bonnick has the largest study to date. 11,000 children were watched over 7 years, and they were divided into two groups: sleep disorder breathing children and children who do not have sleep disorder breathing issues. The children in the sleep disorder breathing group, over their 7 years, her study showed that they were 50% more likely to be diagnosed with an ADD or ADHD diagnosis and treated with medication. 50% is a coin toss for our child to be diagnosed and treated with a medication. Also in her group, they were doing testing. They were doing IQ or intelligence testing along those 7 years. And the children with the sleep disorder breathing, their intelligence testing, their IQ scores were dropping over those 7 years. And that's really not the way it works when you're growing and forming. The formative growing years for a child, when they're sleeping and breathing well, your IQ raises to a certain point and then you kind of plateau. We don't see IQs diminishing amongst children. We don't see IQs diminishing amongst children.
This is the research that Dr. Moralia referenced. Dr. Bonnick studied 11,000 children over 6 years, and she found that there was a strong, persistent association between sleep-disordered breathing and diminished IQ. She also found that sleep-disordered breathing increases the risk of being diagnosed with ADD/ADHD by 50%. So now you may be asking, how is this all connected to bedwetting? Well, we're going to have you watch another video, and Dr. Moralia will speak more about that.
Another thing that might happen is bedwetting. Bedwetting, it's a little more common than people are aware because it's also a best-kept secret. Not many people are running around and advertising that their child is bedwetting at the age of 5, 6, 7, 10, 14 years old. But bedwetting does have a relationship to how we're breathing and our quality of sleep. And some of the causes for bedwetting relate to the way oxygen is exchanged in our body. And the way I'll describe it is this: if we're breathing through our mouth, that air coming into the lung isn't really filtered, warmed, or humidified appropriately, and the body can't exchange it appropriately. So a little less oxygen goes to the brain. Now, the brain is a very sensitive organ. When the brain recognizes little changes in oxygen, it goes to work immediately. Because once the brain starts to recognize a little less oxygen, it doesn't know if we're being choked to death, a very serious condition, or if there's an imbalance in how we're breathing at night, but it does start to trigger a little bit of the fight or flight response. And a little bit of the fight or flight response means the brain's going to look at the body and say, all right, if we've got a little bit of an oxygen issue going on, I'm going to pull oxygen from something that it picks to be unnecessary right now and maybe deliver it somewhere that might be more important, planning on a rare occurrence as if the oxygen was going to stop. So if the brain's recognizing a little less oxygen, all of a sudden it's pulled from the urinary tract. If the body pulls a little oxygenation from the urinary tract, it might void. So we might wet the bed. So we might wet the bed.
So what can we do? It might not be exactly what you think. This video is made by Connor Deegan's Moms. It's a powerful video on how airway and sleep. So, what do we do and how can dentists help? Well, dentists play a huge role, and I'm going to show you some cases of children who were treated in oral appliance therapy by dentists. This is Hunter. You can see that he has a deep bite and no room for his permanent teeth on the left. Now we know this is a sign of underdeveloped upper and lower jaws. This is what it looked like after 10 months in treatment, and he stopped wetting the bed after just 1 week in treatment. Why? Because he was able to breathe better and sleep better. This is Paige. Paige also had a deep bite and a lot of crowding. This is what Paige looked like after just 10 months of treatment. Look at the beautiful development of her upper and lower jaws and that defined jawline. You can see by moving the jaw wider forward, her profile changed dramatically, and so she got a beautiful result. So you might remember Michael from the beginning of the presentation. You'll notice that Michael isn't overweight at all, but the underdevelopment of his upper and lower jaw gave that appearance. And this is Michael at the end of treatment at age 14. Look at the difference in Michael's teeth. Now, he did go through some aligner therapy at the end of treatment, just to close some spacing, but still a beautiful result. But better than that, look at the changes in Michael's airway. This is what we really strive for. Notice the small airway in his before scan on the left, that narrow coffee straw, and look at the curvature in his spine. Now look at his after scan on the right and that beautiful open airway, and his spine is also in alignment. Yes, if only we had known. Naturally, you might have questions about your own condition or what you do for a family member or a friend or a spouse. Well, we're going to transition here, and I'd like to show you some adult cases. This is Dr. Tara Griffin. Dr. Griffin is a dentist out of Florida, and she was her own first patient in the Vivo system. Notice her gummy smile and the changes in her before and after pictures. I'm going to let you hear from her as she talks about how her treatment transformed her life and her practice.
I'm Dr. Tara Griffin. We are here today in my clinic in Panama City Beach. I've been practicing dentistry for over 11 years. Before I discovered the Vivos appliance, I was suffering every day with chronic head and neck pain, TMJ pain. I was practicing dentistry and been practicing for 5 years, but I was already looking for an out. I knew that with this much pain, I could not continue to practice dentistry. I had chronic sinus and allergy problems, bronchitis. I was not sleeping throughout the night very well. I was waking up during the night. I had severe daytime fatigue where I would need to go home and actually take a nap in the afternoon, just at lunch, you know? And so I was looking for a solution to the problem, but I didn't know what the root cause was until I learned about the Vivos appliance. As soon as I started treatment with the Vivos appliance, within the first 2 nights, I was sleeping soundly throughout the night. My energy was better during the day. The pain that I was undergoing took a bit longer to get resolved, but within the first 3 to 4 weeks, my pain level was reduced by 2/3 or more. Within a month's period of time, I was breathing through my nose better. I wasn't having the same sinus symptoms that I was having before. And within 3 months of treatment, my asthma had improved so much, I had no more problems with the inhalers and the frequency I was having to use with all of my asthma inhalers. My overall health started to improve very quickly. I was my own first patient. However, as I continued to treat the next patient and the next patient going forward, I was curious to see if they were going to have the same outcome that I had, and they did. 9 out of 10 had the very similar outcome that I had. So they were sleeping better in just a few nights, actually getting their energy back. They were less irritable. The pain that they had was going away very quickly. The teeth were beginning to straighten and align over time. So even though with this type of problem, it can take some time to get the long-term results, the immediate symptoms start to improve very quickly. Comparing my before and after picture with the Vivos appliance, my smile was not symmetrical. My teeth were crowded. The gumminess of my smile was a major problem that I didn't like. I had unevenness in my eyes, also in my nose. My face was more round and less balanced, and that all helped to correct itself as well as I went through the treatment. When the Vivos appliance is worn in the early evening and while you sleep at night, it allows the jaw to relax. It allows the airway to open up. It allows you to breathe through your nose and to get the oxygen that you need to the rest of your body for your body to begin to heal. By breathing through our nose, we are actually getting much more oxygen to our brain as well as our lungs, and we're producing nitric oxide, which is a vasodilator to allow the blood flow and everything to circulate better. And so a big component with this is it forces you to actually breathe through your nose to get the oxygen where it needs to go into the body. So that's a very important part of this. If you're interested in learning more about the Vivos appliance, if this would be good for you, then I recommend you coming into a Vivos center to be evaluated to determine if this is something that could help you.
Here's another scan. And notice the changes in the airway. Upper airway volume of 7.7 cubic centimeters to start, up to 24.1 cubic centimeters to finish. The minimum cross-sectional area increased from 120 cubic millimeters to 276.5 cubic millimeters. Let's take a look at another case. Notice her before, the very long, narrow face, the lack of symmetry, but look at her transformation as she moved forward in treatment. Clearly, this treatment not only had a huge impact on her overall health, but look at the changes in her appearance. She almost looks like her younger sister. And in many cases, the cosmetic outcome is remarkable. So now meet Christy. Christy actually came in for cosmetic reasons only. She didn't like her gummy smile and wanted to see if there's something that could be done for her. Look at her before and after and the changes she achieved. And take a look at her before and after profile photos. Notice the plumb line and the growth and development she achieved. You can see that in her before photo, her jaw is behind the plumb line, but notice her after and her beautiful jawline that's symmetrical to the rest of her face. So the goal around the Vivos system is to expand the dental arches, and in doing so, promote healthy nasal breathing, train the tongue to be where it should be and function more ideally, and eliminate bad habits. And how are we going to do this? Well, the Vivo system has key components made up of screening, medical imaging, and diagnostics. We want a CT scan to see the airway, an intraoral, extraoral photographs, and an intraoral digital scan to see the bite, the occlusion. We also want to incorporate a home sleep test if that hasn't been accomplished already with your medical doctor. This is a great tool not only for diagnosing obstructive sleep apnea, but in building a comprehensive treatment plan. We also take a personalized interdisciplinary treatment approach. This is an individual approach, and our appliances are specific per patient. And of course, oral appliance therapy, the Vivo system, for both kids and adults. We have the DNA that can be used for upper and lower, the mRNA, which does the same thing that the DNA does, but the mRNA has a mandibular advancement component that pulls the lower jaw forward to open the airway. And we have the Vivos guides. This is our kid system and can be used on kids as early as age 2 and on up 8 to age 12, or until the permanent teeth have erupted. And we also take an integrative approach. We may need to incorporate the expertise of ENTs, chiropractors, orthodontists, myofunctional therapists, or other professionals to treat our patients in a collaborative fashion, as it is a multidisciplinary approach in many cases.
I really feel like Vivos is one of the great answers to the healthcare crisis that's in America, because we're getting to the root cause of what ails a lot of us, and that is not breathing well and not sleeping well.
If you trace back the journey of a sleep apnea patient, that patient is suffering for years before they ever get diagnosed. Once they are diagnosed, they're presented really with two fundamental options. You can go into CPAP and wear a contraption over your face every night for the rest of your life, or you can have what's called a mandibular advancement device, which will actually protrude your lower jaw in an unnatural position to hold your airway open while you sleep, and you can wear that for the rest of your life. Either of those two modalities are going to present that patient with a life sentence of having to wear this contraption, one or the other, every night for the rest of their life.
The interesting thing about CPAP and oral appliances is, although they're very effective treatments, if they're used over a lifetime, the person's condition actually gets worse over time.
Along comes Vivos and says, wait a minute, we have a better option that's all natural, non-invasive, non-pharmaceutical. We can say to a patient, you go into this oral appliance therapy with our protocols, and you go through this treatment for 12 to 24 months. And at the end of that time, there's a high probability that you will no longer have to wear an appliance or any kind of device.
Vivos is literally changing my patients' lives.
It has drastically changed my life. I don't have to use the CPAP anymore. Within just a couple weeks of using the appliance, I was able to breathe through both nostrils, something I couldn't do my entire life. This was revolutionary. Pretty much made me feel excited about life again.
She's sleeping better, I'm sleeping better.
You really feel like you've been given a new life.
It's amazing. I wake up and I'm not in pain.
Because she's sleeping better, is her attitude during the day is better.
I have a better quality of life now. I can't say enough good about it.
I'm getting instant benefit from it. I was amazed. I dreamed every night for 2 weeks straight, and I told my wife, I said, it's amazing. I feel sharp now. I don't feel drowsy all the time. It's been a long time since I felt this good. I wouldn't lay down and try to sleep right now without my Vivos device.
My asthma has gotten much, much better. Without the Vivos, I wouldn't be outside right now. There's no numerical value you can put on this kind of a change. I smile, and I haven't smiled for a long time.
Right after I started using it, I noticed the results really, especially with the snoring. My sleep apnea episodes are a fraction of what they were before. This product's phenomenal. It changed my life.
It's a very comfortable process, but I can see dramatic differences. Now I can really open my mouth. Before it would almost always click.
His ADHD is calming down, he's doing better in school. I can definitely see the difference and the change in him. It's a miracle.
I get to do things now that I would not have been able to. I would not hesitate to do it again.
I am 100% happy that I did this, and I'm thankful every day that I have it because I can breathe.
We bring hope to the millions of people and the millions of families, men, women, and children who suffer from this disease.
It promotes the body's own ability to heal itself because now the body can breathe and sleep well. That's exciting.
So here are some questions you might be asking. How much does it cost? Kids range from $3,500 if we're starting ages 9 to 12 range, up to $6,500 if we initiate treatment earlier at ages 2 to 5. Adults are typically $8,500. We are able to help you utilize both dental and medical insurance. Is it painful? Nope, it's more of a holistic approach. The forces placed on the teeth are passive and subtle. It shouldn't hurt. We can discuss more in person if you'd like a consultation. How long does it take? It can be several years of guide wear for kids depending on the ages that we start. And for adults, the typical treatment time is 18 to 24 months depending on duration of wear each day. Can I see my Airway or assess what the Vivos system can do for me? Definitely. You can call the office or visit our website to set up a consultation with me, Dr. Nolte. We go by first names at Pine Ridge, so you might ask for Dr. Rich. Thank you for watching. We greatly appreciate you taking the time to learn more about Airway and the Vivos system. We look forward to meeting some of you or your friends and family members in the Lincoln area. Thanks.